Good evening, I'm Professor Michael and you're watching Kini News, the show that brings you today's biggest stories. We are seeing a growing number of recoveries and fewer cases thanks to the movement control order. But with more people violating the MCO, could that all change for the worse soon? Malaysia continues to see more recoveries than new COVID-19 infections. During the daily press conference on Tuesday, Health Ministry Director General Dr Noor Hisham Abdullah said there were 202 recoveries in the past 24 hours. While 170 new cases were reported.
Obviously, the projection that today we should have 6,300 cases, but the reality is that we have less than 5,000 cases, which means the MCO 1 and 2 managed to reduce the cases. Today is supposed to be the peak, but if our peak, we have not seen a peak in terms of our graph, it's still, perhaps we managed to flatten the peak, but reduce the cases. Obviously, we have seen a reduce of cases as compared to the prediction. But more importantly, more needs to be done, and this is why we are monitoring it closely, and hopefully the third MCO will help us further.
The total recoveries make up almost half, or 49.7% of the total number of COVID-19 cases. Noor Hisham also reported a small spike in deaths with 5 cases, bringing the death toll to 82. While Malaysia is showing positive signs, that can all change if Malaysians don't comply with the MCO. And authorities are going to make sure people comply with tougher action against violators. Malaysia enters its third phase of the movement control order, and authorities will come down even harder on those still violating the MCO. Defence Minister Ismail Sabri Yaakob revealed today that over 9,000 people have been caught for violating the MCO since it began.
Kita lihat seolah-olah rakyat seolah-olah tidak peduli ataupun tidak takut kepada undang-undang yang kita ada pada hari ini. Mungkin 1,000 tidak dianggap begitu tinggi untuk menakutkan mereka yang terus engkar kepada PKP ini.
In line with this, the authorities will no longer be issuing fines.
Oleh itu, kita telah bersetuju bahawa pihak polis mulai besok tidak lagi memberikan tumpuan kepada kompaun. Mulai besok, sesiapa yang ditahan akan direman ataupun dan dihadapkan ke mahkamah. Biarlah mahkamah yang memutuskan.
According to the senior minister, the court may sentence the offender to a maximum of 2 years in jail, and for the subsequent offence, a maximum of 5 years in jail. The government previously said there is no shortage of PPEs. However, hospital staff around the country are still relying on volunteer groups to provide them with a sufficient supply of this essential safety equipment. Our reporter Vivian Yap has more.
Under the needles of these sewing machines, pieces of personal protective equipment or PPE for frontline medical staffers are being pieced together. The people operating them are several volunteers scattered across different parts of Kuching, Sarawak. They responded to Jacqueline Fong's call and joined a team to produce these essential equipments.
There was a cry from the General Hospital. They are lacking in PPE already. Their stocks are critical. So we just decided, okay, since I have a network of craftspeople, why don't we just get people on the ground to sew PPE for the people from material that we can find right now.
From an initial team of just 25 people, the group has now expanded to have over 90 volunteers. They have churned out a total of 6,000 hood covers, 4,255 pairs of boot covers, and 1,150 pairs of shoe protectors. The volunteers take home non-woven fabric bought using publicly raised funds and return with finished products after painstakingly sewing them together. Feng and 3 other volunteers are responsible for conducting quality inspection, counting, and packaging of the completed goods.
I tell them, listen carefully because lives are involved. This is non-permeable, dust-free, heat-resistant fabric. When you work on this fabric, you must work on a clean surface. Do not have dust or hair or anything on the fabric while you work on it. When you stitch it and your stitch is wrong, do not pick up the stitches because then it's not moisture impermeable anymore, the garment becomes unviable.
80% of their finished products are sent to the Sarawak General Hospital, which is designated as a COVID hospital. The rest are provided to clinics and quarantine centres that have approached them for help. Even then, the delivery is sometimes bogged down by the movement control order.
There was a SOS by Lawas Hospital. Lawas is the tip of Sarawak next to Sabah. SOS, they need PPE urgently. I sent by post laju on Monday, and as at today I checked, it hasn't arrived. It's just a ridiculous situation now. They have to make logistics super smooth at a time like this.
According to the Malay Mail, the Sarawak state government had received 50 tons of cargo purchased from China and said that they will start distributing medical supplies and protective equipment to local government hospitals. Fong said that they are still getting calls for help from quarantine centres and clinics. In the meantime, they will be focusing their efforts on other health clinics, testing centres and quarantine centres in need. Vivian Yap reporting for KiniTV.
With the MCO making their ability to go fishing impossible, the Orang Asli community in Pulau Indah are finding themselves between a rock and a hard place.
Over 80 Orang Asli households in Kampung Sungai Pinang, Pulau Indah, Klang have not received enough aid from the Jabatan Kemajuan Orang Asli or JAKOA during the movement control order. A majority of the people in this village rely on fishing for their livelihood. However, since the MCO came into effect, they have not been able to go out to sea. According to Klang MP Charles Santiago, JAKOA's assistance was a mere one-off contribution of food worth between 40 to 50 ringgit. In addition to that, JAKOA only made the contribution after the lawmaker tweeted that they should be sending food supply to the Orang Asli there.
I came here a week ago and I tweeted specifically trying to get the attention of JAKOA to come to Pulau Indah and also to other areas in the country to respond to the hunger issues faced by the Orang Asli. Somebody called me from JAKOA office, from Ampang, and only after 8 days they had come to provide food for the Orang Aslis here. And the food is worth only about, I think, 40 to 50 ringgit. Now this is not enough. These people have not gone to work or have not gone to fish for the last one month.
Charles added that the Orang Asli here have not been made aware on how they can maintain good hygiene by JAKOA officials.
And also on top of that, the people here have no idea how to clean their hands, how to keep safe, how to be hygienic in this time. And none of them have soap in the house. They don't have soap in the house, so we have to provide soap.
According to Intan bin Pindik, the Tokbatin of the Kampung Sungai Pinang, monetary contributions are more important than food, as it would go towards helping them purchase medicine and sanitation products.
Kira boleh lah, boleh. Lama-lama ini makan bukan sampai lama tak ada, mesti habis punya. Kalau dia sekira Datuk tak tolong, kita terpaksa kita cari makan sendirilah. Cari jugalah sikit-sikit. Kalau tak cari makan macam mana? Tak boleh lah. Kita cuba-cuba jalan jugalah.
Tadi so makanan sekarang tak ada masalah.
Tak ada masalah lah, boleh. Sekarang ni boleh. Tak ada hal lah.
Jadi apa masalah sekarang yang
kita masalah ni cari duit untuk beli ubat itu saja. Cari duit sikit-sikit lah. Tu cuci, sabun cuci, apa semua tu itu kita kena supply sikit lah, kena belilah.
For this husband and wife, their main concern is that the extension of the MCO will disrupt the education of their child, who is about to sit for the School Leaver Certificate or SPM this year. They have no choice but to depend on e-learning facilities despite the problems caused by poor internet connectivity in their area.
Boleh, boleh, tapi masalahnya sekarang ni kita internet tak kuat. Di mobile pun tak ada, lain pun tak ada, tengok saya pun tak ada lain. Cikgu ada bagi kerja sekolah untuk anak-anak. Tapi macam mana kita nak buka, nak tengok. Internet tak ada kuat.
Saya yang nombor 2 ni saya tak kisah sangat lah, sebab yang penting akak dia sedang nak duduki SPM sebab dia dah tingkatan 5 kan. Kita risau sebab langsung tak dapat apa-apa maklumat dari sekolah. Kan? Dia nak bagi kerja sekolah apa, dia nak buat rujukan apa. Tak tahu sebab lain memang susah sini. Saya kesian anak saya yang sulung tu, dia sekolah lagi tapi dia nak fokus pada pelajaran pun tak ada lain, susah.
3 SPM candidates here fear that they may fail the examination because e-learning is of little use to them due to the almost non-existent data connection.
Ada.
sebab tak ada nak terangkan.
Nak buat susah tak faham lah. Dengan internet pun slow
Slow. Ada siapa nak terangkan. Dia pun kawan saya satu tu je dekat Star Cruise. Yang lain pun kat sekolah pun tak nak layan kita. Kenapa? Sebab kita kan orang asli, dia suka kutuk.
Tak ada.
Telefon tak ada?
Ada tapi
Internet tak ada internet.
kita tak tahu guna.
Tak tahu guna internet. Tak tahu guna internet atau tak tahu guna telefon.
Kita guna WhatsApp macam biasa je lah, WhatsApp macam je.
Untuk macam mana nak belajar tu, download kat mana, awak tak tahulah. Kalau ibu bapa mereka tahu tak? Lagi tak tahu.
Lagi tak tahu.
With the ability to only use WhatsApp to communicate, the full potential of the internet via their smartphones go untapped.
Coming up next, China's fight against COVID-19 takes it to its Russian border. A few creative Indonesians are using ghosts to keep people indoors. Don't go anywhere. China's border with Russia is now the focus in its fight against the coronavirus. China's northeastern border with Russia has become a frontline in the fight against a resurgence of the coronavirus as new daily cases rose to the highest in nearly 6 weeks, with more than 90% involving people coming from abroad. Having largely stamped out domestic transmission of the disease, China has been slowly easing curbs on movement as it tries to get its economy back on track. But there are fears that a rise of imported cases could spark a second wave of COVID-19. A total of 108 new coronavirus cases were reported in mainland China on Sunday, up from 99 a day earlier, marking the highest daily tally since March 5th. Imported cases accounted for a record 98. Half involved Chinese nationals returning from China's Far Eastern Federal District, home to the city of Vladivostok. The border is closed except for Chinese nationals, and the land route through the city had become one of the few options available for people trying to return home after Russia stopped flights to China except for those evacuating people. The total number of confirmed cases in mainland China stood at 82,160 as of Sunday. You won't need to call Ghostbusters. All you need to do is just go home if you see a pocong in this village in Indonesia.
Wrapped in white cloth, their faces powdered with pale makeup, the ghoulish pocong are patrolling the streets of Kepo village on the Indonesian island of Java, hoping that age-old superstition will keep people indoors. When the initiative first started earlier this month, the volunteers became a social media sensation, which had the opposite effect on villagers who ventured out into the streets to see the ghosts. Organisers have since deployed the pocong on so-called surprise patrols every few days to catch people who are on the streets. Resident Karno Supatmo says that since the pocong appeared, children and parents have not left their homes. Indonesian President Joko Widodo has so far resisted a national lockdown, instead urging people to practice social distancing and good hygiene. But with the highest rate of coronavirus death in Asia after China, some communities such as Kepo village have decided to take measures into their own hands, imposing the ghostly patrols, lockdowns and restricting movement in and out of their village.
And that is all for me today. For more stories, you can go to KiniTV.com. You can also follow us on Instagram, Twitter, YouTube and Facebook for the latest news updates. I'll see you again tomorrow, same time, same place. I'm Prasad Michael. Thank you for watching.